Hi, I'm Dr. Tom Calton. I am an orthopedic surgeon. I specialize in hip and knee replacements. One of the questions that I am now frequently asked is, why use a robot? Do you use a robot? That's a great question. That is being debated heavily right now throughout the industry. And I have found the robot to be an exceptional tool. Talking robotics and soft tissue work, one of the benefits of using robotics is our ability to need less exposure to make the bony cuts. Well, when you have a knee replacement, you're going to see one incision, and that's right over the skin. The safest way is a vertical incision just above the kneecap to just past the tubercle, which is that little bump on the top of your leg. That's the skin incision. There's another incision that's deep. It's how we get into the capsule of the knee. Historically, we go right around the kneecap and up into the quad tendon. Well, there are other techniques. One of them is called a mid-vastus or a sub-vastus approach. And that approach allows us to preserve more of the quad tendon, and it's easier on the soft tissues and the muscle. And the benefit of that is a quicker return to quad strength or thigh strength, quicker walking, and improved early pain control.
Okay, so we're drawing some anatomy to show the incision that we use when we're doing a Mako assist knee replacement. So your quad tendon is up here. This is your kneecap, but this is all tendon. This muscle here is called the VMO. Historically, here's the tendon. We make the incision along the inside of the patella and on the inside of the tendon, so we can suture this tendon back together. But that's how we get to the knee. Well, this requires a little bit more exposure. When we're using robot assist, the saw is guided by what we call haptics. So the saw, as it goes and trims the bone, it really can't go into the soft tissue and muscle. So we're now able to do what's called a subvastus. We go below. So here's the muscle. These fibers are in this direction. We go and we take the entire muscle and we shift the whole thing over. And then when we finish the case, all of this muscle quadricep function, there's no incision. So this goes away. This falls back into place, and the patient you're about to see is 5 days out, quicker return of quadricep motion, hopefully less pain. These are still painful, but hopefully this is better. Okay, so 5 days out from knee surgery, correct?
Right.
A lot of pain, not much pain?
No pain.
She's never had any pain.
No pain medication, awesome. So go ahead and walk towards me. Very nice. Incision looks really good. Very typical, little bruising is normal. Let's have you go sit down on the chair and do our little chair routine. There you go. Now go ahead and bend it back as far as you can and scoot forward. And that is well over 100 degrees. Now let's bring it out and practice straightening it. Do a leg lift just like that. That's awesome. Way to go.